Hi, I'm Dr. DeFabio and welcome to Relevant Rehab, and today it's about overstriding, understriding for our runners. Now, that is a really serious problem if you're a runner. What we see in the office is usually it's unilateral hip, lower back pain, sometimes it's knee and foot pain, but usually it's more up in the hip and lower back. And it's because the stride length is imbalanced. Now, how do you know if you're an overstrider, understrider? Well, part of it is you can look at your footwear, the wear on your shoes, your shoe wear, okay? You'll see it's going to be imbalanced. You're going to be landing harder on one side than the other side. Again, recurrent hip and back pain could be an indicator of it. Go run on the beach and look at your stride, okay? And you can see if you're overstriding, understriding. Meaning, Mike, just come on over here real quick. And just, we'll face this way, and just take like a short stride, a regular stride with one leg, just a regular stride. Let's say that's how you land always with the right. Now take a big stride on the left. And that would be a bigger stride on the left, and you can see you'd be imbalanced. You're not going to be symmetrical. We don't have a space to do it more than that. So that's what overstriding, understriding is. It'll make you biomechanically inefficient. What are the common causes of that? Well, let's look at them from the bottom to the top, meaning your feet. If your feet are turning out excessively on one side versus the other side, that can lead to overstriding and understriding because a 25-degree foot flare will decrease stride length up to 1 inch. Now, if you're a distance runner, you're losing an inch of stride. Wow, that's a lot, okay? So keep those feet no more than 10 degrees out. Also, when your foot turns out, show what happens, but when your foot turns out, it collapses, okay? That also will lower this leg, all right? So by turning the foot out and the foot dropping down, this leg will get a little lower. If that leg gets a little lower, it's going to create that imbalance of overstriding and understriding, which means a leg length inequality if your hips aren't level, if they're off because one leg is shorter than the other, or because your hips are out of neutral kinematic alignment, that's going to create overstriding and understriding. That could be a chiropractic issue. You may need exercises for the arch. You may need corrective exercises for your feet. We talked about the corrective exercise assessment for runners. We're using the overhead squat assessment. These are all the things that are going through my brain. Where's your problem? If we've analyzed the lower extremity, the feet, the hips, and we know that's all stable down there, well, what else creates overstriding, understriding? Arm swing, okay? Your arm swing needs to be symmetrical. Let's face that way again, Mike. So if the arm swing on his left comes to here, the arm swing on the right has got to come to the same height. If this one's up and then this one's down, you know you're creating overstriding and understriding. And that's when you're walking too. So if you have an imbalance in your arm swing, you're definitely going to have an imbalance in your stride length. Why? It's real simple, all right? Your stride length is relative to how long that you're, I knew that was going to fall, how long you're up in the air, okay? So if you're here, you're going to be in the air longer as you go through, right? If you're here, you're going to be in the air shorter. Okay, it is that simple. So when you walk, keep it in here, and your stride lengths are going to be symmetrical. All right, when you run, keep it in here, and your stride lengths are going to be symmetrical. You're running like this, and your stride lengths are going to be asymmetrical. I mean, you can see it when I'm walking. Or I'm doing this and that, because you're in the air longer when your arm's out longer. Core stability is always a key. Watch those exercises as well. Overstriding, understriding, a huge problem with efficiency as well as in injury management. Check it out, get it fixed, and remember, treat running like swimming, like gymnastics, like golf. Have good technique. With better running technique and mechanics, you'll have less wear and tear on your joints, and you'll be able to run better so you can run more. It's simple. It's the DeFabio difference. It makes a lot of sense to me. and it's going to make a lot of sense to you when you do it, and essentially it's going to prevent injuries. Have a great day. It's been a great day to talk relevant rehab. I'm Dr. DeFabio. Thanks for tuning in, and please like and subscribe. Have a great day.